Today, I'm going to answer the question, what are the top 5 tests I recommend, the top 5 tests you need to protect yourself from heart attack for the rest of your life? Not only heart attack, but heart attack, stroke, diabetes, dementia, Alzheimer's disease. Number 1, you need the clearly coronary artery evaluation. You've heard me talk about this on other videos. And I will continue to talk about it more on future videos because it's the number 1 test I recommend. How can we protect you from heart attack if we don't know what your heart arteries, those life-giving, blood supply-giving arteries in your heart, what do they look like? Is there already disease? And if so, what type of disease? Or do they look perfectly pristine? So after age 40 or 45, everyone needs a clearly coronary artery evaluation. The second test that's of utmost importance is a home sleep study. What do I mean by that? We need to know all night long, how is your breathing? How is your airway? Are you breathing well all night long? I know many of you have heard about sleep apnea, for example. We traditionally thought of an older, overweight individual that had sleep apnea, but now we know that there is a whole host of sleep disordered breathing problems that occur in thin people, young people. So we need a home sleep study to understand, are you breathing well all night long? You've seen on previous posts of mine that 80 to 95% of individuals with obstructive sleep apnea have not been diagnosed. So yes, we want to diagnose obstructive sleep apnea, and we want to diagnose anything that isn't optimal in terms of airway and breathing all night long. So one of the best ways to do that is to get a home sleep study that your doctor can order. That's at least the place to start. However, a lot of the wearable technology that many of us have today can give us some great clues in terms of how well are we sleeping all night long? How well are we breathing all night long while we're sleeping? So the Oura Ring, the BioStrap, the Garmin, I'll talk more about these on future videos, but that's a great place to start, is to share your wearable data with your healthcare provider. And we can oftentimes glean from that data if there's problems or not related to airway and other things. The third most important test in a heart evaluation, or to ensure that your future, you're not headed for a heart attack, or are you, is actually a saliva test. Simple saliva test, just spit in a tube and mail it off. And what we're looking for in that saliva is for any of the 5 high-risk bacteria that reside in the mouth. Now, this can occur at a very young age and all throughout life. It doesn't necessarily, we don't just have this bacteria as we get older. So the earlier we can identify these bacteria and eradicate them, the better for us. We know that 80% of people over age 35 have gum disease, and gum disease occurs from these bacteria. So if you don't know that you have the bacteria, you can't adequately treat it. So we need you to share some saliva, spit in a tube, I say, and mail it off so we can identify if you have these bacteria or not. They're implicated, definitely implicated in cardiovascular disease. And on a future video, I explain the physiology behind how can that actually happen. Saliva, bacteria in my mouth can affect my heart arteries. It is indeed true. And I'll go into that on a future video. And then the 4th most important test when we're evaluating someone's risk for heart attack, stroke, dementia, diabetes, Alzheimer's disease, etc., is to get blood tests looking at inflammation. When we think about inflammation, perhaps you've heard of 1 or 2 things like C-reactive protein, but there's actually several blood tests that are more specific than that can help us determine if you have inflammation in your body that is putting you at risk for diseases in your future or for diseases now. So a blood test with a complete inflammatory panel. And then the 5th test that I recommend is genetics and epigenetic testing. Why do I recommend that as the 5th test? Several reasons. First and foremost, if we know your genetics, we can individualize our recommendations for you. One diet is not the best diet for everyone. One type of exercise. Not everyone goes to sleep early and gets up early, because perhaps you're genetically wired to stay up later or to require less sleep. That's not very common, but it does occur. So we can be very precise about our lifestyle recommendations and even our medication and supplement recommendations if we know your genetics. And then more importantly, epigenetics is all of the things we're doing on a daily basis. Is that truly keeping my bad genes, if you will, these genes that can predispose you to heart attack, stroke, diabetes, dementia, and other chronic diseases? Are we keeping those genes quiet, keeping them dialed down or turned off, if you will? And then are we improving and benefiting and turning up our good genes that are working in our favor? That's epigenetics. You make those improvements in your good genes and you turn your bad genes off by the choices you make every day, in terms of having joy, in terms of doing things that make you laugh, in terms of getting adequate sleep, decisions about what you're going to eat, decision after decision after decision. That's really epigenetics, the ability for our environment and our daily choices to help us improve the manifestation of our good genes and keep our bad genes, if you will, turned off or turned down. That's epigenetics. Well, there's tests that you can do. And that's the fifth most important test that I recommend is, are all of your efforts actually helping you, actually doing what you're hoping that they're doing? So number one, clearly coronary artery evaluation. Number two, home sleep study, or at least share your wearable data with your healthcare provider so we can see if there's some clues that you might not be breathing well all night long. Number three, a saliva test to look for bacteria. Number four, inflammation testing. That requires blood work. And then number five, genetics and epigenetic testing. You can get that with a finger stick, with a blood draw, or with a saliva test. So those are my recommendations for the top 5 tests everyone should have. I'll give you a bonus. Number 6 is to wear a continuous glucose monitor. Really can't talk about heart attack, stroke, dementia, diabetes prevention, even cancer prevention, if we don't talk about how well is your insulin and glucose communicating with each other, so to speak, your metabolic health. Well, one of the best ways to know where you stand with that is to wear a continuous glucose monitor for 14 days and share that data with your healthcare provider. So much great information you can glean from that and make little changes that can make a huge difference over the course of your lifetime. So I will go in more in depth on each one of these topics and each one of these tests on future videos. So subscribe to my channel, follow me on social media, or call my office for more information.